The title of my talk this afternoon is determining the role of SGLT2 or sodium glucose cotransporter 2 inhibition in the development and the progression of diabetic retinopathy. To the audience that may not be very familiar with the topic of diabetic retinopathy, it is a vision-threatening disease that significantly affects the blood vessels of the retina and also the neural structure due to increased blood glucose levels for a prolonged period. It's the most common cause of preventable blindness in adults aged 20 to 74 years. It's globally estimated to grow from 103 million in 2020 to 160 million by 2045, clearly indicating to us a problem with the number of people suffering with this preventable complication of diabetes. It's mainly divided into two stages: non-proliferative diabetic retinopathy and proliferative diabetic retinopathy. Non-proliferative diabetic retinopathy is mainly characterized by microaneurysms or bulging of the blood vessels, and then hemorrhages of the retina, and then proliferative diabetic retinopathy, which is the vision-threatening stage of the disease, is mainly characterized by the growth of new blood vessels on the surface of the retina, or in other words called neovascularization. As many of you would be again aware, animal models in particular are very important to understand a progression or a development of a disease, and also to test therapies for the treatment of specific diseases. And this is the same sort of situation with diabetic retinopathy. We need animal models to test therapies for the treatment of the vision-threatening diabetic retinopathy condition. We have been very fortunate to have a collaboration with Professor Elizabeth Rakowski from the Lions Eye Institute based here in Perth, where we have developed a novel mouse model called the Akimba mouse model for the. So you may wonder, what is this Akimba mouse model? So it's basically a transgenic mouse model that comes from a cross between the well-known Akita mouse model and the Kimba mouse model. So just a bit of background on the Akita mouse model. It's a type 1 diabetic mouse model, which develops the diabetes phenotype due to a mutation in the insulin 2 gene. And this strain is readily available from the Jackson's laboratory in the US. And we have obtained this mouse strain through the Jackson's laboratory. And with our Kimba mouse model that is developed here in Perth, the Kimba mouse model has a overexpression of VEGF that is through the photoreceptors of the retina, and hence develops retinopathy-like features without the presence of the diabetic phenotype. However, when we cross the Akita and the Kimba mouse models together, we end up having the Akimba mouse model, which is the diabetic retinopathy mouse model that develops high blood glucose levels and develops diabetic retinopathy-like features due to the overexpression of VEGF and the interplay of high blood glucose levels. In terms of the transgenic mouse models, in terms of this particular transgenic mouse model, the young Akimba mice, particularly between starting from an age of 8 to 9 weeks postnatal, can demonstrate features of diabetic retinopathy. Some of the key features that this mouse model develops is a range of features such as ischemia, edema, neurodegeneration, inflammation, and fibrosis of the retina. And in addition, it also develops vascular features like microaneurysms, which is the bulging of retinal capillaries, capillary non-perfusion, which is the absence of blood to the capillaries and hence the disappearance of the retinal vascular network, vessels that are constricted, and twisted blood vessels and neovascularization or growth of new blood vessels. And due to this growth of new blood vessels, which are not quite stable, these blood vessels can end up losing its integrity and leaking the contents into the retina, leading to more severe retinopathy stages like hemorrhages and edema. So overall, we have a very good mouse model to test the diabetic retinopathy condition, and also look at treatments for the development and progression of this disease. We have looked at all 3 mouse models during our studies. However, I will be particularly presenting the results from the Akimba mouse model, which is the diabetic retinopathy mouse model in this talk today. So a bit of background on sodium glucose cotransporter 2 protein, which is the key focus of this study. So it is mainly expressed in the renal proximal tubules, as you can see here, and is responsible for the reabsorption of 90% of glucose filtered by the kidney. In addition to its expression in the kidney, we have there is literature showing that the expression of SGLT2 being present in the human lens, as you can see here, and also in retinal pericytes, as indicated here, which are the main type of cells present in the retina, regulating the blood flow within the retinal capillaries. We have recently shown that the SGLT2 protein is also expressed in retinal ganglion cells, which is from the mouse. Retinal ganglion cells are basically the major cell type that is responsible in the retina for visual information processing. So as you can see here, this is the negative control without any antibodies, and this is the SGLT2 positive retinal ganglion cells from the mouse, with the brown color indicating the expression of SGLT2 protein. So as I mentioned earlier, SGLT2 inhibitors are basically considered a novel therapy in type 2 diabetes. For instance, landmark clinical trials as the EMPA-REG outcome trial has shown that the SGLT2 inhibitor empagliflozin significantly reduce major cardiovascular events and mortalities, and also significantly reduce the risk of clinically relevant renal events. Given the broad therapeutic application of SGLT2 inhibitors, such as its role in reducing blood glucose levels, blood pressure, stroke risk, and so on, we wanted to understand its application in the context of diabetic retinopathy. So in this study, to identify this role, we investigated the SGLT2 inhibitor known as empagliflozin. To those who may not be aware of it, SGLT2 inhibitors have a wide range of specific drugs. Empagliflozin is just one out of many. There's others such as dapagliflozin, canagliflozin, and so on and so forth. So looking into the specific aims of our study, firstly, we wanted to determine whether the SGLT2 inhibitor promotes urinary glucose excretion in mice as it does in humans. So the way these drugs work is it basically blocks the SGLT2 protein in the kidney, thereby excreting glucose via urine in humans. So prior to looking at the effect of the drug in our particular diabetic retinopathy mouse model, we wanted to establish that our drug actually does work in mice as it does in humans. And secondly, the aim was to determine the effects of EMPA or empagliflozin on parameters such as fasting blood glucose levels in diabetic mice. And lastly, to investigate whether the downregulation of the SGLT2 activity with empagliflozin reduces the development and progression of diabetic retinopathy. So our main hypothesis was that the downregulation of SGLT2 activity with EMPA may be a novel and a specific approach to prevent the development and also the progression of diabetic retinopathy. In terms of the experimental protocol, so we use particularly male mice at the age of 4 weeks to look at the development of the disease and how it is affected by the treatment of EMPA, and also 10-week-old mice to look at the progression of the disease. And we treated these animals with the SGLT2 inhibitor EMPA or empagliflozin at a concentration of 25 milligrams per kilogram per day, or vehicle DMSO for a period of 8 weeks via drinking water. We then tested the presence of glucose in their urine, and then we completed the experiments at the point of 8 weeks. At this point, we measured the fasting blood glucose levels and collected blood via cardiac puncture to obtain serum. We then euthanized the animals and harvested the retinal and also kidney or renal tissues for immunohistochemistry and immunofluorescent assays. So first, I will present to you the findings from our first study, which is the study looking at the effect of EMPA on the development of diabetic retinopathy. So just keeping in mind that these mice are quite young, they start at the age of 4 weeks and they get treated for a period of 8 weeks with the SGLT2 inhibitor EMPA or with vehicle. So firstly, to determine that our drug is actually working as per it does in humans, we made sure that the urine that these mice excrete contains glucose. This was done using a simple dipstick test, as you can see here. In the non-diabetic mice, as indicated by the blue color, there is no presence of glucose in the urine. However, with the EMPA or empagliflozin treated mice, the dark brown color indicates the presence of glucose in the urine in non-diabetic mice. This clearly indicates to us that our drug is working, blocking the glucose transporters in the kidney, excreting glucose into the urine. We then looked at mainly the body weight in the young Epstein-Barr mice. A point to keep in mind is that generally type 1 diabetic mouse models, like the Epstein-Barr mouse model, is considerably smaller in size when compared to their non-diabetic counterparts. As you can see here, indicated by this continuous blue line, the vehicle-treated non-diabetic Epstein-Barr mice are considerably heavier compared to the diabetic Epstein-Barr mice. So with the disease progression, these Epstein-Barr mice with vehicle, as indicated by this panel here, shows a failure to thrive or inability to gain weight. However, with the treatment of EMPA, we identified that these mice were able to maintain a healthy weight gain, preventing the failure to thrive phenotype in the Epstein-Barr mouse model. We then looked at fasting blood glucose levels in the diabetic Epstein-Barr mouse. As you can see here, in the vehicle-treated mice, the blood glucose levels at fasting was over 30 millimoles per liter. However, this was significantly reduced with the treatment of EMPA at the end of the experiment of 8 weeks. One of the key features of diabetes, particularly in this mouse model, is that they consume a higher amount of water intake due to the presence of diabetes, indicating the improved diabetic phenotype in these mice. At the end of the experiment, the EMPA-treated Epstein-Barr mice showed a significant reduction in fluid intake. We then looked at the retinal vasculature in these animals, and this was done using the immunofluorescence staining method with isolectin B4 and streptavidin Cy3. As you can see here in the above panel, we have indicated several retinal vascular features, such as regions with no capillaries indicated by the green asterisk mark, and diffuse lectin staining indicated by the yellow arrows, and boxes indicating microaneurysms or twisted blood vessels in clumps, and also indicated by the blue arrows, which are macrophages and monocytes, which are infiltrated immune cells. So when you compare the vehicle-treated animals to EMPA-treated animals, we saw a considerable reduction in these retinal vascular features in the Epstein-Barr mice treated with EMPA, as shown in the panel here below. We then performed a semi-quantitative grading of these retinal vascular features. The plus mark in this table here indicates the presence of lesions, and the negative mark indicates the absence of lesions. The higher number of plus marks basically shows the increased severity of the vascular feature. And as you can see here in the vehicle-treated diabetic retinopathy Epstein-Barr mice, there is many plus marks in all the retinal vascular features that we were looking at. However, with the treatment of EMPA, there was a considerable reduction in these retinal vascular lesions, as indicated by the single plus mark or the negative symbol. This indicated to us that the SGLT2 EMPA, SGLT2 inhibitor EMPA, decreased the rate of development of diabetic retinopathy in this Epstein-Barr mouse model. One of the key features that we see in diabetic retinopathy is vascular leakage. As you can see here, this is a healthy retinal capillary. The retinal capillary basement membrane is generally intact, and this prevents the leakage of contents within the blood vessels into the retina when you are not having a condition like diabetic retinopathy. However, in the diabetic retina, as indicated by this lower panel here, the blood retinal barrier integrity is compromised, leaking the contents within the retina into the surrounding retinal capillary, into the retinal structure in the surrounding unit. One of the key ways of looking at vascular leakage in the retina is looking at the vitreous albumin levels, which is a protein, as indicated by the brown color here. This is a well-established marker of vascular leakage in humans and also in mice. So as indicated by this upper panel here, the vehicle-treated Epstein-Barr mice showed a increased presence of albumin in the vitreous when compared to the EMPA-treated animals, as indicated by the lower panel. We then did a quantitation of this, and there was a significant reduction in the vitreous albumin levels in the EMPA-treated Epstein-Barr mice with diabetic retinopathy. We then looked at the well-established marker of the pathogenesis of diabetic retinopathy in both non-proliferative and proliferative diabetic retinopathy stage, which is vascular endothelial growth factor. As you can see here, although it was not significant, there was a reduction in the VEGF levels in the EMPA-treated animals when compared to the vehicle-treated Epstein-Barr mice. We then looked at differential gene expression using the RNA-seq method. As seen here, the blue color dots indicate the group of genes that were decreased in this cohort, and the red color dots indicates the upregulated or increased expression of the genes in this cohort with the EMPA-treated mice. We then looked at the top genes of this panel. I'm not sure how clear this slide is. However, we identified several key genes that are involved in diabetic retinopathy that was differentially upregulated in Epstein-Barr mice after the treatment of EMPA. And these genes have been identified as beneficial genes, and hence this indicates that the treatment of EMPA is a beneficial treatment in the context of diabetic retinopathy. And the key genes that are also relevant in humans have been identified with the red color boxes among the other genes that are upregulated. We also had a few genes that were significantly downregulated in the EMPA-treated Epstein-Barr cohort. Again, the red boxed genes have been identified in humans as pathogenic genes in diabetic retinopathy. Hence, the reduction with the treatment of EMPA is a promising finding in this diabetic retinopathy mouse model. As some of you may already be aware, diabetic retinopathy and diabetic kidney disease goes hand in hand. Quite often, the onset of diabetic kidney disease is rather delayed in humans with diabetic retinopathy. However, it is well established that diabetic kidney disease is inevitably a condition of diabetic retinopathy, provided you are having conditions like diabetic retinopathy. Given this, we wanted to look at the kidneys of these animals with diabetic retinopathy. When we initially looked at the kidney body weight ratio in these animals, there was a slight reduction in the EMPA-treated animals when compared to the vehicle-treated animals. Renal hypertrophy is a characteristic in early diabetic kidney disease. And this was kind of giving us an indication that this mouse model might be developing diabetic kidney disease or nephropathy as well. However, in this young cohort of mice, as much as there was a reduction in the kidney body weight ratio, indicating improvement in renal hypertrophy, we did not see any pathological alterations in the renal tissue. So the summary of our first study, which was the study looking at the effect of the SGLT2 inhibitor in the young cohort of diabetic mice. Firstly, we showed that in young non-diabetic Epstein-Barr mice, the SGLT2 inhibitor EMPA promoted glucoseuria, confirming the efficacy of our treatment. And in the young Epstein-Barr mouse model, the SGLT2 inhibition with EMPA firstly improved fasting blood glucose levels, and also the fluid intake, indicating better glucose homeostasis in these animals. And secondly, substantially reduced retinal vascular abnormalities associated with diabetic retinopathy, indicating a reduced disease severity in these animals, and significantly reduced vitreous albumin protein levels, indicating the alleviated retinal vascular leakage in these mice, and also diminished the expression of the vascular endothelial growth factor protein levels, potentially improving diabetic retinopathy induced vascular damage, and also altered the retinal genetic signature, revealing novel candidate genes of diabetic retinopathy. And lastly, decreased kidney body weight ratios, which was suggestive of improved renal disease in these animals, starting at an earlier age. I am then going to present to you with the effects of EMPA or empagliflozin on the progression of diabetic retinopathy, which is the second part of our study. As I mentioned previously, these animals were older in age, around the age of 10 weeks. where the disease has actually progressed, and we started seeing many key features of diabetic retinopathy in these animals without the treatment. So as per the younger mice, we also did the establishment of the efficacy of our treatment by doing a simple urine glucose dipstick study on the non-diabetic Kimba mice. As you can see here, the vehicle-treated animal did not show the presence of glucose in the urine when compared to the EMPA-treated animals, indicated by the brown color showing the presence of glucose in the urine. Again, we looked at the body weight data of the Kimba and Akimba mice. Again, in the Akimba mice indicated by this dark blue continuous line, you can see these mice are considerably smaller when compared to the Kimba mice, which is indicated by the red color, the light blue color line in the left-hand panel. So again, these animals, the diabetic animals, do show a phenotype of poor weight gain, which is a hallmark of uncontrolled type 1 diabetes. And this was improved with the treatment of EMPA, as indicated by the dark red line in this panel here. Although it is not significant, this was a very important finding to show that these mice do not become frail over the experimental period. We again looked at the fasting blood glucose levels in these animals as well. As expected with the treatment of EMPA, the diabetic Akimba mice showed a significant reduction in fasting blood glucose levels when compared to the vehicle-treated animals. As per the young animals, we also looked at the fluid intake in the older Akimba mice. Even from the start of the experiment, which these measurements were taken at day 3, the older animals showed a increased fluid intake with the treatment of EMPA. However, this was significantly reduced at the end of the experiment at 8 weeks, indicating that the treatment of EMPA alleviated the hyperglycemic status in these animals, basically supporting the blood glucose findings in this mouse model. As shown in this panel here, this is a vehicle-treated mouse retinal vasculature stained with isolectin B4 and streptavidin Cy3 after 8 weeks of treatment. I'm not sure how clear this image is, but what I would like to bring your attention to is these white color boxes. These are the regions of the retina showing large structures that is intertwined and creating large microaneurysms and microvascular abnormalities. And these yellow asterisks indicate regions that does not have any blood vessels present in the retina. And the absence of these blood vessels in the retina or capillary non-perfusion is a hallmark feature of advanced diabetic retinopathy, indicating that the retina is lacking blood supply, leading to oxygen deprivation, which is a key feature of proliferative diabetic retinopathy. What we were able to show was with the treatment of the SGLT2 inhibitor EMPA, these features such as microaneurysms and intraretinal microvascular abnormalities indicated within the small white boxes were significantly reduced, and also these regions of capillary non-perfusion indicated by the yellow asterisks was considerably decreased in the Akimba mice treated with EMPA. As per the previous study, we did a very similar comparison of the retinal phenotype, looking at the semi-quantitative grading, as you can see here, in the older Epstein-Barr mice treated with vehicle. There is many plus marks indicating the increased disease severity in these animals. However, with the treatment of EMPA, this was significantly improved, indicating that the SGLT2 inhibitor EMPA decreased the progression of diabetic retinopathy in the Epstein-Barr mouse model. I'd like to bring your attention particularly to the Epstein-Barr mice treated with EMPA with the mouse numbers 1, 3, and 4. These mice actually showed a very clear organization of the retinal vasculature with very minimal retinal vascular lesions, indicating that the treatment was actually very effective in these animals. One of the key things that I would like to bring to your attention is that regardless of the efficacy of the treatment, if the disease severity is very progressed, the treatments were not effective. As you can see here, this is a vehicle-treated animal with disease. We looked at the renal hypertrophy feature again in this older Epstein-Barr mice. And as you can see here, there was a slight reduction in the kidney body weight ratio, indicating improved renal hypertrophy in these animals. Interestingly, what we also identified was that these animals showed an improvement in the pathology of the kidneys with the treatment of EMPA, which is indicated by the lower panel of this figure here. The top panel is the non-diabetic Epstein-Barr mice, and the middle panel is the diabetic Epstein-Barr mice treated with vehicle, which shows dilated tubules indicated by the T symbol, and the box shows the presence of renal fibrosis, and these figures have been taken from individual mice. So with the treatment of EMPA, as you can see in the lower panel, this renal phenotype associated with diabetes was considerably improved. We also looked at fibrosis in these animals. As shown in the middle panel, the vehicle-treated mice showed the presence of renal fibrosis indicated by the blue color in the mesenteric staining. And this was again significantly improved in the EMPA-treated mice as indicated in the lower panel. We performed periodic acid shift stain, which is a staining done to look at glomerular hypertrophy and basement membrane thickening and mesangial matrix deposition in the kidneys. And as you can see here again, in the diabetic Epstein-Barr mice treated with vehicle, glomerular hypertrophy or enlarged glomerula were quite obvious, as indicated by these arrows. And then this was significantly decreased in the EMPA-treated animals as indicated in the lower panel. So in summary of our second study, which utilized the older Epstein-Barr mice with a progressed disease. Firstly, we showed that in the non-diabetic Epstein-Barr mice, the SGLT2 inhibitor EMPA promoted glucose urea, confirming the efficacy of our treatment. And in old Epstein-Barr mice, SGLT2 inhibition with EMPA improved fasting blood glucose levels and fluid intake, indicating better glucose homeostasis, and substantially reduced retinal vascular abnormalities associated with diabetic retinopathy, indicating reduced disease severity, and decreased kidney body weight ratio suggestive of improved renal disease, and lastly, significantly improved diabetes associated renal pathology. So in conclusion, what I'd like to highlight is that this is the first study that is showing that the SGLT2 inhibitor EMPA should be further studied in humans as a viable treatment for diabetic retinopathy. I'd like to take this opportunity to thank my great team and also the animal facilities for assisting with animal work, and also our generous funding bodies. Thank you, and I am willing to take any questions from anyone if there is any.
Thank you, Lakshini. Thank you very much for excellent presentation, very informative and very relevant because I mean, diabetic is a big deal here. About 10% of the Sri Lankan population, adult population, is under some form of medication. So for diabetes, so I think it's a big deal, and it's a very important and relevant topic. Thank you very much. So now the floor is open for discussion. We can take questions from the audience. You can just identify yourself and ask questions, or you can even use the chat box. I think Sachini can look after the chat box and relay the questions. But I mean, this is especially for students. I mean, feel free to ask questions right away directly from Lakshini, and I'm pretty sure she's happy to take a few questions. Shall I ask a first question before
Yes.
others start asking questions? One thing about your mouse model, I have two kind of related questions. One is that, so how the diabetes is induced in these mouse models? Is it pancreatic, alteration, or is it something else? And then I'll let you answer that question first.
So basically, so what happens, particularly if I start off with the Akita mouse model, which is a very well-established diabetic mouse model, Sampath, the misfolding in the insulin 2 gene in these mice, and therefore there is almost like a type 1 related diabetic phenotype developed in these mice. So lots of studies done on this particular mouse model related to diabetic retinopathy, which is my interest with the particular study. However, because it is only a diabetes mouse model, the disease doesn't progress quick enough. Hence, we have taken the Kimba mouse model, which is a specifically designed mouse model to increase the vascular endothelial growth factor in the retinal photoreceptors. So we now have the best of both worlds by crossing the mouse model, which is a transgenic mouse model, the Akita, with our Kimba mouse model, generating the Akimba mouse model, which has the high blood glucose levels, and also that overexpression of vascular endothelial growth factor in the retina.
Awesome. Great, thanks. I'll just ask another one more question. Sorry, I feel like I'm misusing my power as the conductor. Anyway, just something relevant in the mammalian kind of aspect. So the one issue of the diabetics in humans is that our longevity. So we live longer. So the accumulation, prolonged exposure for the of the alterations leads to neuropathy, nephropathy, and then and related complications. But these rats are their mouse models they are much shorter lived. So would they show the same kind of progression of nephropathy and neuropathy as well, or is it just very short early stages if you compare that to humans in terms of the pathology?
That's actually a very good question. So I think with some of the mouse models that are currently available, like a mouse model like the Akita, which just have only diabetes, you do have to keep them for a very long time to see the actual disease progression, which even matches the early stages of the human disease. But the beauty of having the particular A-Timba mouse model, which has that overexpression of the key protein that drives the diabetic retinopathy features, which is VEGF, actually gives us a really good spectrum of the disease from a very young age, starting from about 8 to 9 weeks of age of these mice, all the way up till about 20 weeks of age. So the disease progression is quick, but we do capture pretty much all the pathological features of diabetic retinopathy seen in humans in this particular mouse model.
Awesome. Thank you. Yeah, over to the audience. Sorry.
On that same question, Sampath, one of the things that we have done, which no other groups have done, is basically characterize this mouse model for other complications, because this mouse model was particularly designed for diabetic retinopathy. But we have now taken the opportunity to try and characterize this mouse model for kidney disease, for instance. So the data that I presented to you has been done for the first time in this mouse model. So again, the kidney disease, this mouse model shows a very similar progression like to humans. Earlier in the piece of the disease, when you just have retinopathy, most people don't have nephropathy, but over time, people develop nephropathy and your retinopathy gets more severe. So our next goal is to try and characterize this mouse model for cardiac diseases related to diabetes as well.
All right, you scares me anyway. All right, I already have a bit of I'm a diabetic and I have a bit of eye issues. So you're saying that the nephropathy and neuropathy will follow.
The key thing is basically to maintain your blood glucose levels. That's like basically the known way of managing any complications. Like my mother is a diabetic, a type 2, almost like a type 1 now, because she's dependent on insulin. And she has exactly the same issue. She's got retinopathy, but we are trying to keep her retinopathy without progressing to a severe condition, and also trying to prevent any other conditions. And I'm not sure of the current context of drugs in Sri Lanka, but these SGLT2 inhibitors, particularly empagliflozin, is almost like a first-line therapy in conjunction with metformin and insulin and other drugs here in Australia now. Even without diabetes, they have found very profound effects on heart and kidney disease with this particular class of drugs. So it's kind of now come to the level that these drugs are basically prescribed to people with heart conditions, even with the absence of diabetes.
I see. Interesting.
Perhaps
yeah.
Something to talk.
I have some other. Yeah, I have a whole series of questions, but I think I'll let the audience to. Otherwise, they'll be very upset. Yes. Thank you, Lakshmi.
Very simple question, Dr. Lakshmi. It was very interesting mouse model, and maybe because I'm interested in mouse models, I feel that it's very, very interesting. So, is there a specific reason that we are using male mice? Is there a male-based prevalence in the disease?
Yes, so that's actually a very good question, Sakshini, because particularly with these mouse models, what happens is the females have all the hormones, and the disease phenotype, even starting with diabetes, tends to be a bit skewed in females. Although we have looked at the females, the disease severity is a lot less in the females, and hence we found that the treatments may not be quite effective. So as much as the treatments has to kind of be applicable to both males and females, we first wanted to establish whether the treatments actually have an effect, and hence we've used the male mice.
Okay, thank you.
Lakshini, I have a question. Can you hear me?
Yes, Maheshi.
Yes, so I'm kind of interested. It's a really interesting presentation, Lakshini, and I'm interested with the how you have studied the vasculature of the retina with respect to the drug that you have given. So like you showed that like in your second study in the old mice, they have like developed vasculature because of the treatment. So is it promoting angiogenesis or like, I mean, may I know the reason behind that?
So yeah, very good question, Maheshi. So basically what we wanted to look at was give the drug before the disease actually starts developing in these mice, because the start of the age of starting to show the key features of retinopathy is around 8 to 9 mark. So we want to give it to the earlier mice at 4 weeks to try and see whether we can halt the retinopathy phenotype. In the older study, what we actually saw was it doesn't completely stop the development of the features, but what it does is it prevents it going to that next stage of leaky blood vessels and retinal hemorrhages and the likes. So I think one of the drawbacks of a mouse model that has a vascular endothelial growth factor overexpression is no matter what we do, we can't diminish the VEGF levels to a baseline level that it does not have an effect. So we do still see the neovascularization or growth of new blood vessels, but it is quite decreased when compared to the vehicle treated animals.
Okay, because like the reason that I have asked that question is like this growing blood vessels and this angiogenesis process, they are kind of like when it comes to all the mice or all the humans, they are related with kind of a progression of tumors, because I mean, if they have tumors. So, I mean, do you have any thoughts on that aspect? Like see whether it is affecting the tumor condition as well?
Look, actually, one of the things that we always question is if the retinal blood barrier is compromised, is the VEGF actually leaking out of the retina and giving a systemic effect? So your question is really valid to see whether it leads to other organs which may have angiogenesis. So maybe one of the things that we might end up doing over time is when we characterize this mouse model is try and see whether those sort of features are prevalent in other organs. But to the best of our knowledge with what we have with the retina, that phenotype is or was confound to the retina because the mouse model was designed to study diabetic retinopathy.
Thank you. Thank you for your answers.
Yeah, we have a few more minutes. We can get a few more questions.
Lakshini, Mahesh, and Sampath, just purely out of curiosity with what I have read with regards to the work that all of you do. My understanding is all of you do have animal models in Sri Lanka as well. Can I get an idea of what might be available in Sri Lanka?
No, we don't. We actually don't have any knockouts or transgenics. We only have wild type animals in here.
Oops.
We have biopsies.
Lakshini?
Yes, sir. Maheshi?
I can hear you, Sachin. I think, sir.
Sir lost the connection.
Yeah.
Okay. So, as I said, we don't have any transgenics or knockouts. We have the wild type mice, BL6 biopsies, then IRC only. Yeah. Even zebrafish, we don't have knockouts or any genetically modified organisms.
Can I ask, Sachini, what sort of work happens with the currently available like wild type animals? Do you do like diet-based studies or?
Not in our department, but I know some people who are working on diabetes in Jawatanpura University. There could be people whom I doesn't know. So in our department, no. But we do a lot of anti-inflammatory studies or immunomodulatory studies, and yeah, because we have this specialty in immunology, we go for such studies. And I know when many other departments, like in Japura, they test a lot of, I think, pharmacy work also, some sort of pharmacological work also related to animals. And we also do some testing of some Arabic drugs and Oriental medicine, things that are related to Oriental medicine also, I think, yeah.
It's very interesting, and it's very nice to see that Sri Lanka has moved on to doing preclinical studies using, animal models, because when I was in Sri Lanka last in 2007, working at the Faculty of Medicine, having animals was not even an option. And I think it's a very great resource if you can afford to have them. We end up collecting a lot of tissue and actually using them across many, many years to generate lots of data. So yeah, it's really nice to see it. I should definitely come and see you guys when I visit Sri Lanka.
So I have to tell something on that. I mean, we need to thank Sachini because she's working a lot on that, and like she has like established the animal facility again with like in a good condition, and the work is going on. And like for me, I'm actually kind of new to these animal studies, but like when it comes to the getting the expertise knowledge, we are always going for Sachini's help. So like we are very fortunate in that aspect.
And I'm very proud of Sachini. I have seen her from Bangladesh, and the growth is very obvious. I think the Animal Resource Center here in Perth, in Murdoch, one of the people there used to come to Sri Lanka to establish some of the work that was done with keeping the animal lines in Sri Lanka clean, because I think they had some problems when they were doing the inbreeding process and things like that. I'm not sure which university they went to, but it's really nice to see it. And I'm happy to help if there's any help that we can give from distance or when I'm in Sri Lanka. Even with the techniques, we do a lot of dissections. We do a lot of different types of injections like tail veins and IP injections, subcutaneous injections, and yeah, more than happy to help and collaborate if the opportunity is there and if the need arises.